So much I'm not going to be, taking my child to a psychiatrist, even if my pediatrician says, please go. I'm not going. So what's happening is you've actually wasted all the efforts you've put in all these years. So if you do not treat, you're going to see your child slowly kind of go down in strength, slowly go down in abilities, and the happiness in your house comes down slowly. You see a child who's more and more sad, more and more withdrawn, more and more dysfunctional, and the whole family starts feeling the pain from that. So not treating the child because of some fear of being stigmatized, of some fear of being labeled as mad, or the doctor will put on some medication and that medication will create some problem. These things will basically bring down the quality of life of both the children as well as the family. As far as the side effects of the medicines, all these medicines, the most common side effect is either it might make you a little bit more sleepy, or it can make you put on weight. These are the most common early side effects. If it doesn't suit you, of course, headache, vomiting, nausea, diarrhea, constipation, these are all usual, very simple things. Your doctor can easily sort these things out. The main worrying thing is this weight gain and perhaps oversleepiness. The oversleepy child doesn't respond to much of inputs by the various other therapists, and so that becomes a problem. But then when you interact with your doctor, your psychiatrist, you explain, they will always titrate, adjust the medicine dose to make sure that oversleepiness is not there. Weight gain, biggest problem by way of side effects. The weight gain can lead to other metabolic syndromes which Dr. Jashi and Dr. Shankar have been talking about earlier. So all these metabolic syndromes can happen, and so again, we got to be watchful. Worst case scenario, we stop the medicine, because there are some cases where some of these medicines can actually create an abnormal sugar status, like a diabetes. So we got to stop the medicine, and it reverses. Some of these medicines interfere with the periods. Sometimes it's amenorrhea, the periods don't happen. Sometimes it's too much of bleeding. Permanent problems. Lots of literature. There is this talk about movement disorders called dyskinesias, which come on late. Tardive dyskinesia, TD they call it. The TD at one level is not dangerous. It's not going to damage the child. It's not going to damage the patient. It's a little bit disfiguring. It's like people do. It looks nasty when you see. And no, nobody would like to have it. But it's not a dangerous thing. It's not going to be as debilitating as perhaps somebody who's having persistent hallucinations. His life is going to be extremely, damaged. So when you look at all these things, you kind of balance the effects and the side effects, the improvement, the quality of life, the level of side effects. There are so many little adjustments you can do around. So do not be afraid. Medicines have side effects, but they're all manageable, mostly. Most of them are reversible. Very, very, very rarely there's any irreversible side effect, like the tardive dyskinesia. So they can be managed. Not treating will worsen and bring down all the gains the child has had over the years of intense input by everybody. Not treating will put a strain on the parents, put a strain on the siblings, put a strain on the entire system, maybe the school, and everywhere you're going to kind of suddenly, the equilibrium which you have very carefully worked for.
चक्कर या मितली आना इस तरह के साइड इफ़ेक्ट हो सकते हैं जिन्हें बहुत आराम से आप
live. Though I know you can hear me right till the back. Okay, I'm screaming now. So, thank you so much. Yeah, Brinda is there to help you. You have something to say? She's getting a mic.
This is to you only, sir. See, I come from a city called Indore, which is not as advanced as Chennai or Mumbai or anything. So, particularly with psychiatry, what I have observed is the diagnosis is done, but then it needs a psychologist to support on the treatment. Orthopedics, we have physiotherapists, but we don't have a structure where a good psychologist is available. So it is like you are diagnosed, but you are not able to treat. And that, to us as a helpless parents, leaves us, nowhere. So my request to Rekha ma'am and to you also, sir, can you have a similar structure what ma'am has developed over the years to support the parents like us, wherein we can also look at a similar support structure, maybe online counseling, or I don't know what that could be, but where the parents like us can also get benefit. That's a simple request, so that we get the benefit. Otherwise, we just diagnose and we don't treat.
And this is a problem not just with Down's syndrome. The number of psychiatrists in the country itself is very small. Apparently, there are only about 4,000 to 5,000 psychiatrists in the entire country. I'm talking about psychiatrists. As for psychologists, aren't that many people. There are some institutes which give good training for a clinical psychologist. But that is also a rare breed. What happens very funnily, we've been noticing, most of the people who've done their masters in psychology, they get grabbed by the HR departments of big companies for a very fat salary. So it's more interesting for them to, take a detour and rather than sit with people, patients, counsel and all that. Because a number of them find it very tiring and they feel they are not getting the rewards they would get as a HR person. We can train people. Psychological counseling is not some, rocket science. It can be very, very simple, common sense. People can, at least learn not to do harm. Even if they don't do major improvement, they can help, they can support. Very often, patient listening by anybody itself is like a psychological counseling.